I am Dr. Thompson Akwo, international political leader, international physician, international communicator, editor, publisher of Health and Development magazine. Updates, global health, maternal reproductive health, women's health, chronic diseases or non-communicable diseases, breast neoplasia, breast tumors, breast cancer, the biopsychosocial-spiritual model in the control of breast cancer. And today I want to talk to you and update you on palliative care in oncology, breast cancer, spirituality in breast cancer work. It's not been too long ago when the director of the Jewish, that is the George Washington Institute of Spirituality and Health, Washington, D.C., Dr. Christina Pulchalski, the director and president of the Institute of Spirituality and Health at the Texas Medical Center, the ISH. I like to call him Professor Graham, MD, or medical doctor, consultant specialist in plastic surgery, PhD, ministry, head of the Institute of Spirituality and Health, and the other MDs and consultants in palliative care at the MD Anderson Cancer Center, working in partnership with the Methodist Center of the collaborative called the Texas Medical Center, brought what is known as the Summit or Conference on Palliative Care. And there were people from different departments, board members, sociologists, anthropologists, clinicians, researchers, epidemiologists, ministers and counselors, clinical, pastoral counselors, chaplains, to discuss palliative care and spirituality. To many, palliative care is hospice care. And as I say, to our pink sisters out there, when somebody or a lady is diagnosed with breast cancer, you know, whether we like it or not, we must face reality and talk reality. The breast is aesthetic, what they call the mammary gland. That's what the breast is actually called, the mammary gland. And in embryology, after the zygote is formed, when the sperm and the ovum come together after ovulation and meeting of male and female, there is, as I have always said, differentiation and then maturation and differentiation, where the cells begin to group and divide and then differentiate into different groupings that specialize into different tissues and organs that come together to make different body systems. So the mammary gland is actually the milk producing gland of the humans, and we see the same in animals. Those of you who have pets, dogs, and the others, cows, a lot of the milk that you drink comes from the breasts of the mammary glands of the cows and the animals that you milk. So, during this Breast Awareness Month of October 2021, I continue to bring you this awareness updates on breast cancer. And today I am highlighting and updating you on the place of spirituality in palliative care. Now, spirituality has been defined variously. But I am not only an ordained minister of the gospel, I have also lectured in seminaries and national ministerial conferences where prelates and bishops and pastors and leaders of the synod, women fellowship leaders, men, come together in centers, and I come in to speak on health and spirituality. I've done that a lot in Africa and other places, and I've spoken in cancer, awareness meetings here in the United States, and some of the work that we have done in Europe, especially as it relates to specific cancers that are related to HIV/AIDS, Kaposi sarcoma, Hodgkin's lymphoma, cancer of the cervix, head and neck cancer, and the others. But that's not what I'm saying. What I'm actually telling you is palliative care, spirituality in breast cancer work, especially for the survivors, those who are undergoing treatment. For a lot of you, it may be pains. A lot of you, it may be psycho-spiritual issues, crisis of belief. But the first thing I want to tell you is that if you feel like your cosmetic issues need to be addressed, we have plastic surgeons who work alongside those who are doing lumpectomy, removing the lump, if that's all they have to do, or mastectomy, depending on the type and the extent. Because as I have said, we talk about grading in cancer work and staging. And the stages go from stage 1 to stage 4. Stage 4 is not too good, because at that point we know that there's seeding of cancer cells beyond the breast to the armpit or the axilla and to the nodes. And so if we take out the nodes or do a biopsy of the nodes, we may be able to find the breast cancer cells there. From there, they may have even gone through the bloodstream to other places like the liver or so. And so stage 4 is not too good. That's why we keep saying that there is need for you to do the screening and the examination so that we can pick breast cancer early enough. But let me go back to what I'm saying. The psycho-spiritual input. End-of-life issues as it relates to metastatic breast cancers may be very troublesome. For some people, Immediately there is the diagnosis. There is the issue of denial and grief. There is even grief even after the mastectomy is done. You can imagine if the whole breast area is actually resected, taken off, or do a radical mastectomy, and then we are going right under the armpit or the axilla. We are taking away the lymph nodes and everything. Working in the teaching hospital. For some of you who come to Anderson Cancer Institute or Center at the Houston Medical City, you will have the advantage of being taken care of in a medical school, because the University of Texas Medical School is actually, or the MD Anderson Cancer Center is part of the UT Health, which is part of the University of Texas system, which is actually run by your tax dollars from the federal government and from the state of Texas, notwithstanding partnerships here and there and contributions here and there. And there is a palliative care division unit of the MD Anderson Cancer Section, and they are consultants, MDs, who are specialized, subspecialized in that area of palliative care. So why should we be too bothered? Because palliative care on its own is not curative. It's, to an extent, you could just call it supportive care. Maybe there's pain. And so there are people who are specialized on how to relieve pain. And you start talking about acupuncture and some related things, that yoga and some of those things that we discuss during my everyday, training at the ISH, or at the Texas Medical Center, the Institute of Spirituality and Health. And I thank Dr. Graham, because I have a certified, declaration from that institute that I studied there for more than a year. But 14 months or 15 months or 16 may not be enough. So I have continued to study in that area. And I will tell you that there is a lot that we've been doing. Because if you look at this, it says the Pontifical Academy Pro Ita. What does it say? It said the Pontifical Academy. And here is a conference that we did called the PCS Life Conference. The PCS Life Conference. And the Palliative Care and Spirituality for Life. The Palliative Care and Spirituality for Life Conference. The Houston Methodist Research Institute, the John F. Brookout Auditorium. That's where we had it. And it's in collaboration with the University of Texas MD Anderson Center. It is written here, in collaboration with the University of Texas MD Anderson Center. And it was hosted by the Houston Methodist Leading Medicine. Now, let me make it very clear. A lot of people don't actually know the difference between when they say the Texas Medical Center, what it really means, and the institutions or medical or hospital systems which are there. First of all, those hospital systems are independent hospital systems of their own. Because a lot of you keep hearing, oh, the Texas Medical Center, I'm going to get the treatment at the Texas Medical Center. In the most part, don't say that. Because the Texas Medical Center on its own is a corporation of institutions. The offices that run that corporation are very, very small within that medical city. So when you say, oh, I'm going to get breast cancer treatment at the Texas Medical Center, what do you really mean? You may be going to Bentop, which is part of Harris Health. You may be going to the Methodists. The Methodists have oncology section. You may be going to Anderson. And right in there, we have medical schools. We have Baylor that does a lot of its residency teachings and practice with Bentop. But the medical school of the University of Texas, in its cancer work, actually does that at MD Anderson. But just to show you and tell you a little bit more, I will read out of here some of the people who are involved in this, because right in there, we have the magazine of the Texas Medical Center, that is a monthly thing, actually produced this and was talking about the meeting. And it says here, Palliative Care and Spirituality for Life, Houston Methodist Research Institute to host a joint conference with the Pontifical Academy for Life on September 17. And so it was actually reported by the Texas Medical Center magazine. And it says, in July, these and representatives of approved HR, the Palliative Care and Hospice Education and Training Act. Then you come here to say that art that comforts near the end. An artist offers solace in MD Anderson's palliative care unit. And we had the program, and these were some of the things which were discussed. Declan Watts, MD, University of North Carolina, Atrium Healthcare System, talks of Ohio Health and Journal of Palliative Medicine, reflection from 50 years of cancer care and its impact on current end-of-life care, University of Arbetha and McGill University, the state of the art in palliative care, advocacy for the ever more effective control of physical pain by Constantino Benedetti, MD, the Ohio State University and the International Association for the Study of Pain, Medicine, Palliative Care, Spirituality, the Anthropological Perspective. This is Robin Warren Lovin, PhD, Southern Methodist University and Loyola University. Then there was a break. Then we came back. There was a session on working of the human spirit in palliative care. Oh, the human spirit. Carol Taylor, RN, PhD, Kennedy Institute of Ethics, Georgetown University, and Robert F. Fine, MD, FACP, Baylor, Scott, and White Health, Spirituality, Religion, and Psychology, the Reverend Renzo Pegorano, MD, Pontifical Academy for the Life, Integrating Spirituality Care into Palliative Care Practice, Chaplaincy Perspective, the Reverend Betty Hightower, Doctor of Ministry, BCC, Houston Methodist, Psychotherapy Focus on Spirituality, Meaning, Dignity, Hope, Harvey Kochinovic, MD, University of Manitoba, and Cancer Care, Manitoba, Whole Person Care Clinical Model, Launch, Pain, Ancient and Modern, Session, Medical Humanism in Palliative Care Practice, Narrative Medicine, a model for empathy, reflection, profession, and trust, Relation, Autonomy, Palliative Medicine, and moving beyond the limits of isolated individualism, the challenge of measuring and communicating integrative values of palliative care. Session, an interfaith roundtable on the role of religions in palliative care. Panel discussion, white paper for the global palliative care advocacy. So let me look at an interfaith roundtable on the role of religions in palliative care. So we have Sheldon Robinfield, we have Nunziata Comoreto, and the others. Now I have showed you all of these so that I can begin to learn. For those of you who have been diagnosed with cancer and you have anxiety, fear, the first thought is, I'm about to die. I don't know what's going to happen to my children, to my family, and all of that. Then there's this denial. How did it happen? Why can this happen? I'm a Christian. I've been doing good things in the world, and why did God let this happen? Oh, my fellow pink ladies. Then the denial. Then when you come to acceptance, I want to tell you that there are resources out there, spiritual resources, how to cope if you are in hospice care, especially when it relates to breast cancer. If you are a survivor or you have a relapse and these issues are there, the Pontifical Academy has brought a lot of people, but they were not the first. We've been working with Dr. Graham, Christina Puchalski, and the others to give you the best. And I'm saying that spirituality helps you with issues of coping with life, meaning with life, your purpose, and reorganizing your life. And then you can do better and cooperate better with your physicians and those who are giving you end of life or whatever care. Because most times we have the best of cares. Even with surgery, the patients who are less anxious, they bleed less, they have other less problems, they cooperate more and they do better. So I have introduced to you the place of spirituality in cancer care. Thank you.